Okay, for consonants, using this criterion, we can determine two different articulatory parameters for consonants. For example, the place of articulation, where is the obstruction occurring, where we can use the way of articulation, which means that what type of obstruction is involved, and the third parameter is binary regarding the state of the glottis, which means that whether the vocal cords vibrate or not. And further criteria concern the type of airflow involved, but in this unit we will concentrate on consonants produced with pulmonary representation. Liquid stream pulmonic here, we will not look at the consonants produced with glottal A key or with lyric V. A stream, this types of A stream will be discussed separately to understand the parameters. Primary articulation, we have to deal with some anatomical details about the vocal tract. The first consonant can be articulated at any point along the upper surface of the oral cavity. So along these lines here, the upper surface point involved in the articulation of the consonant is referred to as the passive articulator. The ER passive articulator is a position in the vocal tract that is involved in the production of speech sounds but does not move starting from the front of the vocal tract. Past passive articulation errors can be classified, for example, lower and upper teeth. Now, upper teeth are the location where the tongue makes contact to produce several different consonants such as far. Teeth are the position where the lips make contact to produce consonants such as far, and another passive articulatory. Far is the alveolar ridge. The alveolar ridge is the area of articulation of many consonants located directly behind a teeth. A typical consonant is the tarsar or rar. The palate, or sometimes called the hard palate, is the area for a large number of consonants, often referred to as the roof of the mouth. The consonants will be something like in the area above the mouth of a typical consonant is the car or gah, another area that is not used as a contact area for the production of some consonants such as s, ha, and then we have further areas that are naturally articulated, such as, for example, the nasal cavity, which the main non-oral resonant space. Consonants involving the nasal cavity are usually consonants such as ma or na. At the back of the mouth, we find the foot pipe or its aegus. The trachea or windpipe is used for breathing and for airflow. And finally, we have the epiglottis here, which attaches to the anterior part of the thyroid cartilage and serves as a cover for the entrance to the larynx during swallowing. Okay. The next place of articulation is life. The place of articulation of your teeth, where we can observe the narrowing between the lower lip and the upper teeth. The typical consonants are by far our most distant teeth. The dental area involves the narrowing between the tongue and the upper teeth. Here is the consonant a. The next place of articulation is the alveolar place, namely the alveolar ridge, and of course, it involves the narrowing between the tongue and the alveolar ridge. Here is the consonant S and R. That is the appendage that hangs down and is easily visible if you open your mouth and look in the mirror at the very end, and then we have the glottis. Okay. The glottis is a part of the larynx and it is the source of phonation. The position at which contact between the active and passive articulators is produced is called the place of articulation. I will choose fricative consonants, which means that the consonants which produce turbulent airflow per place of articulation, and I will do it between two vowels for better audibility reasons. Let's start with bilabial consonants now. Okay. And for the SR of the post-alveolar area is just a little further back.